Osteopathic manipulative medicine is a way that a DO can use our hands to diagnose and treat medical conditions that usually affect the joints, the muscles, and other tissues in the body. There are certain complaints that are just bread and butter for OMT. There's knee pain, there's a tight muscle, there's a pulled muscle, there's things like that, there's headaches. Things that I know OMT almost always works for, or at least we can give it a try. So generally when I start OMT with a patient, I'm going to do a functional assessment or like a symmetry assessment. That's my osteopathic examination, my overall exam. And that may pick up some asymmetry in the body, the way someone carries themselves, the way they move, as well as taking into account their history, what complaint is bringing them to the table right now. And then we can sort of get into a treatment for one area of the body or for the whole body. Sometimes I do treatments that are multiple areas, and sometimes we just focus in on one problem area. Osteopathic manipulative medicine really is in line with my therapeutic approach of a healing touch. I feel like I can do so much to help treat patients with my hands and help them to move better, to feel better, and that really helps them have more of a sense of well-being as well as a better connection with the physician-patient relationship. I don't think in these times we have a lot of doctors who really have that therapeutic touch with patients. It's more just sort of, you're over there and I'm talking to you, and then I send you a prescription to your pharmacy and see you later. But I really like to form that touch and that therapeutic bond with my patients, and I think it goes a long way. Some misconceptions commonly about osteopathic physicians and OMT in general are that we do the same thing as chiropractors, and to an extent that's somewhat true. We can do the same things as chiropractors, but we can also do much more, as well as prescribe treatments and medicines if we need to. The thing I'm most excited about doing OMT with the direct primary care is just having enough time to do the treatments and not feeling rushed. We can't really be rushed by the clock when the tissues of the body just need to declare what's going on. One of the most rewarding things when I see my patients who have been treated with OMT, they come back to me and say, oh my gosh, like last time I was so tight I couldn't even bend down and tie my shoes. And now look at me go. Those sorts of things are amazing when it's just, all I had to do was treat with my hands and we didn't have to do anything else. I think those are super rewarding and fun, as well as the patient feels so much better.